Welcome back to the deep dive. Ready to put on those thinking caps?
Always.
Excellent. This one's going to be interesting. Today, we're taking a deep dive into the world of vomiting and regurgitation in small animals.
Oh, every vet's favorite topic.
Right. Well, we've all been there, right? I
Yeah.
mean, who hasn't had a case come in and thought, okay, what's going on here?
Yeah.
So our guide for this case, our trusty sidekick, if you will, is Chapter 2, From Clinical Reasoning in Small Animal Practice.
Uh-huh.
And the goal here, you see this all the time in practice, but how can we really streamline how we're thinking about these cases so we can accurately and quickly diagnose and treat these, vomiting, regurgitating patients?
Right. And one of the first things that the book really emphasizes, and it's such a crucial point, is that you have to be able to differentiate vomiting from regurgitation.
Right.
Because treating those two as the same thing can lead you down the wrong path.
Big time. Yeah. The book actually even goes into like the mechanics of each, process. It's kind of like if you're thinking about it like a detective, we're analyzing the footprints left at the scene of the crime.
Yeah, that's a good analogy. So, like, when we think about vomiting, we're talking about an active expulsion of stomach contents, right?
Okay.
And it involves the brain, the abdominal muscles, the diaphragm. It's like a whole coordinated effort.
So a lot going on.
Yeah, a lot's going on. But then when you think about regurgitation, it's more of a passive process, right?
Okay.
It's basically just the backflow of undigested food or liquid from the esophagus.
Gotcha.
So there isn't that forceful expulsion that you see with vomiting.
So I'm thinking like we've got a worried pet parent, they come in with Fluffy or Fido and, the pet's not looking so hot.
Mm-hmm.
What are some of those like quick clues, you're in that exam room that can help you be like, okay, this is vomiting. Oh, this is regurgitation. Like, how can we make that distinction right off the bat?
Yeah, well, I think the first thing is to observe the animal.
Right.
Like, what does the animal look like when this is happening?
Yeah.
Are they retching? Are you seeing those abdominal contractions?
Gotcha.
That's your vomiting.
Okay.
That's them actively trying to expel something. But with regurgitation, it's more passive.
Okay.
So they may just kind of lower their head and the material comes out.
Okay, so not as much effort involved.
Exactly. And then look at what they're bringing up.
Okay, the evidence.
Yes, the
You
evidence.
gotta examine it.
Exactly. If you're seeing partially digested food mixed with bile, that's more suggestive of vomiting.
Gotcha.
But if it's just undigested food or maybe some foamy liquid, that leans towards regurgitation.
And the book brought up the idea of aspiration pneumonia being like a real risk with regurgitation.
Yeah, that's a big one.
And it's kind of like our regurgitation rogue left behind this dangerous, like, calling card, right? Why is aspiration pneumonia more of a risk with regurgitation than it is with vomiting?
Well, because during vomiting, remember, we've got this whole coordinated effort going on.
Right.
Part of that is that the epiglottis, it closes off the trachea to prevent anything from getting down into the lungs.
Like a little trapdoor.
Exactly. But with regurgitation, you don't have that same level of control.
Okay.
So the material can just kind of come back up, and if the animal's not strong enough to cough it out, it can end up in the lungs.
So we've figured out, we've got vomiting or regurgitation, right? We've identified our suspect.
Right.
But the case isn't closed yet.
Right.
You've got to figure out, is the GI tract, like, is it the mastermind behind this whole operation?
Mm-hmm.
Or is it just an innocent bystander caught in the crossfire?
Exactly. That's a great way to put it. We need to figure out if this is a primary GI disorder, meaning the problem is actually in the gastrointestinal tract, or if it's secondary, meaning the GI tract is just reacting to something else going on in the body.
Right. So the book uses those terms, primary
Right.
and secondary.
Right.
But for our detective analogy, let's think of it as like an inside job versus an outside influence.
I like that, yeah. So an inside job or a primary GI disorder would be something like gastritis, right?
Okay.
Or foreign bodies, inflammatory bowel disease.
Okay.
The problem is originating within the gut itself. But an outside influence or a secondary GI disorder, that's when something outside the GI tract is causing the problem.
Okay.
So, it could be kidney failure, liver disease, even certain cancers.
Right.
The body's basically saying, hey, something's wrong over here, and I'm going to let you know about it by vomiting or regurgitating.
It's like sending a signal.
Exact.
Okay, so how do we start gathering the evidence to figure out, is this an inside job or an outside influence?
Well, it starts with a good history,
Oh,
just like a detective would interview witnesses, right? You want to ask the owner, when did this start?
okay.
How often is it happening? Is there any pattern to it? Like, is it related to meals?
Gotcha.
Are there any other symptoms? That history is going to give you a lot of clues.
That's like your witness statement.
Exactly.
Right, okay.
Yeah.
So after we've gotten our witness statement, what's next?
And then you move on to your physical exam. That's like dusting for fingerprints.
Right.
You're looking for any clues that might point you in the right direction.
Okay, so if we're suspecting an inside job, like a primary GI issue, what are some of those fingerprints we might find?
Well, you might find palpable abnormalities in the abdomen.
Okay.
So like a mass or a thickening of the intestines, something that just doesn't feel right.
Okay, so you're feeling around, trying to see if anything is out of place.
Exactly. And you might also see concurrent diarrhea, or maybe the vomiting is happening consistently right after meals.
Okay, so that's telling us that the issue is probably localized to the GI tract itself.
Right. It's all happening within those same walls, so to speak.
Okay, but what about those outside influences? What if we're thinking it's a secondary GI issue? What kind of clues are we looking for there?
Well, in those cases, you're looking for signs that the problem started elsewhere in the body.
Okay.
So, for example, you might see jaundice, which is a yellowing of the skin and gums.
Okay.
That could indicate a liver problem.
Gotcha.
Or you might see PUPD, which is increased thirst and urination.
Right.
That could be a sign of kidney disease or a metabolic disorder.
Okay.
And pay attention to the timeline. Did the pet seem generally unwell before the vomiting started?
Okay.
That can be a big clue that something systemic is going on.
So if Fluffy was just moping around, not her usual self, and then suddenly starts vomiting, that's a red flag.
Exactly. It's like the body's sending out warning signals before the main event.
So it's not just about the vomiting itself, it's about the bigger picture.
Precisely. Now here's where things get a bit tricky. There are some culprits who try to disguise themselves.
Ooh, sneaky.
Yeah. Like canine pancreatitis, the book mentions that it can really throw you off the scent.
Okay, so how does canine pancreatitis try to tool a fast one on us?
Well, even though it's a pancreatic problem, which is technically an outside influence, it can present with sudden vomiting, often after a fatty meal, even in a dog who's otherwise seemed perfectly healthy.
So it can look like a primary GI issue even though it's not?
Exactly. It's like the pancreas is trying to frame the stomach.
Sneaky pancreas.
Yeah.
So we might not see those typical systemic signs right away with pancreatitis in dogs.
Right. But cats, on the other hand, tend to play by the book.
Okay.
They usually show those classic outside influence signs when they have pancreatitis.
So cats are a bit more straightforward in that sense.
Yeah, they're not as good at hiding their clues.
Okay. So let's say we've gathered enough evidence. We've got a good idea of whether it's an inside job or an outside influence. What's our next move? What's the next step in our investigation?
Well, if we're suspecting a primary GI issue, an inside job, we need to figure out where in the GI tract the problem is brewing.
Okay.
Is it in the upper GI tract, like the stomach or small intestines?
Okay.
Or are we dealing with something in the lower GI tract, like the colon?
Right. We've got to narrow down the crime scene.
Exactly. And this is crucial because it helps us choose the right tools for our investigation.
Give me an example.
Sure. An endoscopy can be a really powerful tool for visualizing the upper GI tract,
Okay.
but it can't reach the lower regions.
Gotcha. So depending on the location of the issue, we need to use the right tool for the job.
Exactly. It's all about being strategic. Now, what if we're suspecting an outside influence, a secondary GI issue?
Yeah, how do we track down that real culprit?
That's where our lab comes in handy.
Okay.
Clinical pathology becomes our forensic analysis.
Ooh, I like that.
Yeah. A chemistry panel can reveal those hidden metabolic villains,
Okay.
while a complete blood count can point to inflammatory or infectious processes that might be lurking in the shadows.
So it's like we're shining a light on all those potential suspects.
Exactly. And imaging, like radiographs or ultrasound, can also provide valuable clues.
Right. We need to see the bigger picture.
Yeah.
Now, what about regurgitation? Does location matter as much with that rogue?
Regurgitation is a bit unique. It's
Ow.
almost always a dead giveaway that the esophagus is the scene of the crime.
Oh, okay.
Unlike vomiting, which can originate from a lot of different locations, regurgitation really narrows our focus.
So it's like finding the suspect's fingerprints at the scene.
Exactly. It pretty much guarantees they were involved, but we still need to figure out what they were up to.
Right. Okay, so we've narrowed down the location, we've gathered our evidence. Now it's time to unmask the true villain behind all this gastrointestinal chaos.
Exactly. Let's talk about those specific lesions that can cause vomiting and regurgitation.
Okay, let's do it.
So, for vomiting, we need to consider a whole lineup of suspects.
All right, let's hear it.
If it's an inside job in the stomach, think gastritis, foreign bodies, ulcers. And if the intestines are the crime scene, enteritis, obstructions, inflammatory bowel disease, those are all high on the list.
So we've got our usual suspects for primary GI issues.
Right. But we can't forget about those outside influences.
Right. Got to keep our eyes open.
Absolutely. Remember that table we talked about earlier, table 2.2 from the book?
Oh, yeah.
It's like our criminal database listing those key secondary GI disorders and the tests that can help us identify them.
It's like our cheat sheet.
Exactly. Keep it handy.
Okay, so with all these potential culprits, do we put every vomiting patient through the full interrogation and investigation?
That's a good question. And the answer is not always.
Okay.
Sometimes, with those straightforward open and shut cases, a little symptomatic treatment is all it takes to restore order.
So like a mild case of gastritis from a dog who got into the trash can.
Exactly. A little rest, a bland diet, maybe some anti-nausea medication, and they're good as new.
Right, right.
But there are certain red flags that should make us suspicious. Those clues that tell us we need to dig a little deeper.
Okay, what are some of those red flags? What makes us reach for our magnifying glass and our forensic kit?
Well, regurgitation is always a red flag. We need to get to the bottom of what's going on in that esophagus.
Okay.
Lack of response to symptomatic treatment is another big one. If our initial slap on the wrist doesn't do the trick, we need to investigate further.
So if the vomiting is relentless, or if Fluffy was already looking under the weather before the vomiting started, those are signs that we might be dealing with something more serious.
Exactly. And don't forget about those physical exam findings. Any palpable abnormalities in the abdomen should send those alarm bells ringing.
It's like finding a hidden weapon at the scene of the crime.
You got it. It changes the whole nature of the investigation. It's all about using our clinical judgment, our detective intuition, to determine which cases need a full-blown investigation and which ones can be resolved with a simpler approach.
Right, right. It's like we're constantly balancing those two sides, the art and the science of veterinary medicine.
Exactly. We need to be thorough, but also practical.
Okay, so we've talked about a lot of important clues and strategies for tackling vomiting and regurgitation. Can you give us a quick recap of the key points we've covered?
Well, I think the big takeaway here is that when it comes to vomiting and regurgitation, you really got to be a detective.
Right.
It's all about observation, deduction, and pattern recognition. The more cases you see, the better you become at picking up on those subtle clues and putting all the pieces together to solve the mystery. You know, it's almost like you're building your own mental database of suspects, motives, and evidence.
Yeah, I love that. And this deep dive has really highlighted how, like, everything's connected, right?
Oh, absolutely.
They're focusing on these signs, vomiting and regurgitation, but it's a reminder that the GI tract, it's not just this isolated island. It's constantly talking to other organs and systems.
Yeah, it's like a central hub.
Right.
It's connected to everything.
So we can't just focus on the gut. We have to think about the whole animal.
Exactly.
All those outside influences, that might be contributing to the problem.
Yeah, you gotta widen your scope.
Right.
Expand your investigation beyond the initial crime scene.
So as we're wrapping up this case file, what's the most important lesson you want our listeners to take away from this deep dive?
I would say it's the importance of having a structured approach.
Okay.
When you encounter a patient with vomiting or regurgitation, don't just jump to conclusions.
Right.
Ask yourself those key questions. Is it vomiting or is it regurgitation?
Yeah. Okay.
Is this an inside job or an outside influence?
Right.
Where's the location? What's the lesion? By following those steps, by thinking systematically, you're going to avoid those knee-jerk reactions, and you're going to be much more efficient and accurate in your diagnosis.
And that structured approach not only helps you, solve the mystery, but it also empowers you to communicate more effectively with pet owners.
Absolutely.
Right. You can walk them through your thought process. You can address their concerns.
Exactly.
And ultimately, build that trust.
Yeah, it's about, being a true advocate for your patients and their families.
Well, I think we successfully cracked the case of vomiting and regurgitation today.
I think so, too.
We uncovered the secrets behind those crucial clues, explored the the potential motives of our gastrointestinal culprits,
Yeah.
and we armed ourselves with a really powerful system, I think, for solving even the most perplexing cases.
Absolutely. And remember, this deep dive was just a glimpse into what Chapter 2 of Clinical Reasoning in Small Animal Practice has to offer.
Right.
So, I highly encourage you to go check out the full chapter, really delve deep into those specific conditions, the diagnostic techniques, the treatment strategies.
Yeah, excellent advice. And to our listeners, thanks for joining us on this deep dive.
It's been a pleasure.
We hope you gained some valuable insights that you could apply in your own practice. Until next time, keep those brains engaged, keep those stethoscopes ready. We'll see you on the next case.